Okay, the title is called How to Stay Active as a Senior in Florida. This presentation is designed to educate senior women on the ways to stay physically active while living in Florida. It may be challenging to try and remain fit, especially in places such as Florida where the weather may be too hot or humid to exercise outside. The average temperature in Florida can reach up to 89 degrees Fahrenheit. It is important to find activities that do not contribute to dehydration. Another challenge may be arthritis or other health conditions that may make exercise challenging. Some of the challenges of staying fit as a senior woman in Florida include the heat, finding workout buddies, staying hydrated, challenges with arthritis, cognitive issues, and medication, and also finding a safe workout. It is important to assess the learning needs of the senior adult to identify any challenges that may arise. There may be barriers to assess that prevent physical activity. Prior behavior must be identified along with situational and personal influences. Some of the learning needs assessments and questions that need to be asked is what time of the day do you exercise? What type of exercises do you enjoy? How much exercise per week is safe and healthy? Do you have any health conditions or medications that prevent you from staying physically active? Also, are you ready to begin a new workout? The model that will be used is the Proceed-Proceed model. The Proceed-Proceed model is a comprehensive structure for assessing health needs, for designing, implementing, and evaluating health promotion and other public health programs to meet those needs. Some of the factors involved in assessing include the following. Social assessment. The social problems include a lack of physical activity in female seniors. The epidemiological assessment is the health determinants, including an advancing age that may include health issues such as arthritis, cognitive issues, and the risk of dehydration due to certain medications in the heat. An ecological assessment is the behavioral and environmental determinants that predispose, reinforce, and enable behaviors and lifestyles, including advancing age, the warm weather, and health conditions that may make it difficult to exercise. Implementation of interventions includes finding appropriate times of the day to include physical activity and meeting regularly with a physician to evaluate the exercise plan. For implementation, design intervention is assess availabilities of resources and implement program which will include available resources in the area such as senior centers that can provide exercise programs that are inside and away from the heat. The process evaluation includes senior exercise programs that are located inside and also aquatic programs that can help target the senior population. As an evaluation, we'll evaluate the change of behavior. The outcome, according to evidence-based practice, including exercise programs such as Silver Sneakers, promotes physical and emotional benefits to seniors and encourages activity. The health education plan. The physician will let the client know how much exercise can be performed per day based on the client's health. The client will begin an exercise plan of her choice. The client will also learn to exercise early in the morning or later in the evening. The client can also choose exercises at local community centers that are inside, such as indoor swimming. The client will be provided with educational pamphlets and resources that can be used as tools to help identify age-appropriate exercise within the community, as well as a weather chart for each week. The health education plan. One goal includes an exercise plan created for the individual with 3 behavioral outcomes. These include the client will meet with a physician to discuss an exercise plan that is safe and appropriate. The client will identify healthy exercises, and the client will know how to stay hydrated and know appropriate times of the day to exercise. Okay, so the evidence-based practice, 3 articles that were used was Impact of a Senior Fitness Program on Measures of Physical and Emotional Health and Functioning. In this article, it's best integrated into the education part of the plan. The article states that it's best for seniors to join a group exercise, such as the one suggested in the article called Silver Sneakers. It has both a physical and emotional impact that can allow support from similar clients in the same age group to encourage exercise. The next evidence-based practice article is called Aquatics, a viable activity option for seniors with memory impairments. The strategies for success can be integrated into the health promotion and education plan, which can include a behavioral outcome, which includes identifying different types of exercise for those with physical and cognitive disability, which include aquatic exercise. And the third evidence-based practice article is medicines can affect thermoregulation and accentuate the risk of dehydration and heat-related illness during hot weather. In this article, it best fits into the learning and physical assessment part of the plan. The patient must be assessed for any types of medications and health risks that can cause a risk of dehydration, especially when exercising in warm weather such as Florida. Okay, so the evaluation part. The client will be reevaluated about the exercise plan. If any changes may need to be made, adjustments will be made accordingly. A physician will also evaluate the client's health to ensure that an exercise program is effective and that all medications are still effective with the plan. According to the evidence-based practice, it's found that the program Silver Sneakers and aquatic exercise is the best type of intervention to promote exercise among the elderly. The client will continue to be assessed throughout with questions that include: what time of the day do you work out? How often do you work out? What types of exercises have you enjoyed the most? Have you seen a physician, and has the physician approved your workout regime? Do you have any side effects from your medication since you have begun the workout? The conclusion. The client will have frequent evaluations and reassessments if needed to ensure continuation of an effective exercise plan. It is important for female seniors to continue with an appropriate exercise regime that is supervised by health professionals in order to promote health and safety. Florida can have warm temperatures that can affect seniors and can lead to dehydration, so it's very important to reassess the exercise plan to ensure that they're getting the proper exercise to promote health.